That this session is on the record. If you'd like to raise if you'd like to ask a question, please raise your hand in Zoom. And before I fumble over another line, I will turn it over to Dr. Christ.
Good afternoon, everyone. For those that are joining us for the first time today, I'm Dr. Cara Christ. I'm the director for the Arizona Department of Health Services, and I thank everyone for taking time out of their Friday to join us today. As usual, I will give a brief presentation and then I will turn it over for questions. And my remote is not working. Yeah, let's see. Okay, so apparently power, yes, power works. Thank you. All right, thanks, guys. So we'll start off with our COVID-19 data. I've added a couple of slides in here today, but I'll start off with the normal ones I show. So this is the cases by week. You can see that we had a significant decrease since that first week in January. And we've continued to decrease. We currently have plateaued. We're seeing minor increases, but right now they're staying relatively stable. It is something that we are watching. As well as this is our epidemiologic curve, or our epi curve. So this shows the cases per day by collection date. And then you can see the 7-day moving average, which is that red line. And then all of the important events throughout the pandemic are indicated on the at the certain points on that graph. Those that are in red are still in place, so you can see that as of March 24th, all Arizona on that graph. Those that are in red are still in place, so you can see that as of March 24th, all Arizonans are currently eligible for vaccination. That would be Arizonans who are 16 and above. But again, we continue to monitor our cases each day and what our pandemic trend is looking like. Percent positivity is an important indicator because it does tell us about the spread in the community. This one's a little different than when you go to our laboratory services page on our dashboard. What you can see here is this is the total number of tests that are performed on our website. It shows it by unique Arizona patients. But you can see that when we look at the unique Arizona patients, which are indicated by the gray portions of the bars, you can see that those tests account only for about 50% of the total tests that are being run in Arizona. And a truer picture of the percent positivity as we've continued to move through the pandemic is our percent positivity based on the total number of tests performed, because many Arizonans are getting multiple tests or are doing routine surveillance of themselves either for work or for their own personal knowledge. And you can see that our percent positivity has increased slightly. It is seeming to level off around 3 to 4%, but we continue to monitor that as well after the big decrease since the beginning of January. I usually just talk verbally about what we're seeing in our hospitals, but I just wanted to show the slides of some of the data that we monitor here. So this is the number of inpatient beds. When you look at the orange, those are inpatient beds that are taken by COVID patients. The blue is beds that are taken by non-COVID related patients. And then the gray beds at the top are those beds that are available from a inpatient or a medical surgical bed perspective. The same thing with our ICU beds. When you look at the orange, again, those are ICU beds that are currently occupied by COVID patients. The blue are ICU beds that are occupied by other patients that do not have COVID. And you can see that the gray bars are the available ICU beds. We're seeing the same kinds of trends when you look at our COVID-like illness syndromic surveillance. So we've been utilizing this metric throughout the pandemic. It's one of the consistent metrics we've had. And you can see that our COVID-like illness continues to drop. This is the average between the inpatient and emergency department use for COVID-like illness. But just like our beds and our cases, we are seeing declines on that. So now I'll talk a little bit about vaccine distribution, and then we have some exciting announcement this week. So In Arizona, all 15 counties are currently vaccinating those that are 16 and above. Pfizer has become more widely available throughout the state. In addition to the Pfizer, which is the only vaccine of the 3 vaccines that's approved for those 16 and 17-year-olds, we administer that at our 7 state-operated pods. However, there are pharmacies now that are offering Pfizer. And you can find those statewide, and then the Moderna and the Johnson & Johnson are available to those who are 18 and above. Because we've been getting vaccine for several months, this used to be a very, very long chart that we did by week. We've collapsed it to be by month, but you can see that by next week, we expect to have received a projected total of 5.1 million doses of COVID-19 vaccine. These account for both first and second doses. And again, these doses are allocated between the state pods, the 15 local health departments, and 4 tribal allocators, as well as some of this will go to went to the CDC Long-term Care Pharmacy Program. And so you can see this coming week, in May. This includes the week of May 2nd, which is not here in Arizona yet, but we anticipate getting about 394,000 doses of vaccine. And today we announced an exciting milestone. Arizona has administered over 5 million doses of vaccine, with almost 3 million unique Arizonans receiving at least 1 dose. And almost 2.3 million Arizonans have been fully vaccinated. So we're very excited about hitting that milestone. There's still a lot of work to do, but we'll talk to you about some of those plans. And late last week, CDC and FDA lifted the pause of the Johnson & Johnson COVID-19 vaccine. If you'll remember, on April 23rd, we recommended, in alignment with the recommendations from the CDC and the FDA, we recommended that providers can and should resume using Johnson & Johnson following the safety review that they did. This was based on a pause that of an extremely low number of adverse events involving a very specific blood clot with low platelets or thrombocytopenia. They wanted to pause. They wanted to be able to review additional cases if they were out there. And they also wanted to be sure that providers had the information of what to look for and how to treat this specific syndrome, which they are now calling thrombocytopenia syndrome. These cases occurred primarily in females that were between the ages of 14 and 49. Based on their evaluation, they felt that the vaccine was safe and effective to be and able to be resumed in the United States. You can find out more about the robust federal safety monitoring that they perform. Adverse events get reported through VAERS, and those that have received the vaccine get the opportunity to enroll in vSafe, which is a vaccine monitoring program that you can do through your phone or other mechanisms to let them know how you're doing after you received the vaccine. So that was exciting news, because the Johnson & Johnson is that 1-dose vaccine and is an important component for reaching our rural areas and some of our hardly served areas, and those individuals that would be difficult to find for a second dose. As of this week, we have over 1,200 provider sites that have received vaccine supplies. We've had over almost 1,500 long-term care facilities receive vaccinations, and that's over 137,000 shots administered to those residents and staff at those sites. And we now have over 975 pharmacies receiving vaccine through the Federal Retail Pharmacy Partnership Program. And as we're starting to get additional vaccine in the nation, you will see that all of our pharmacies who have enrolled in the Federal Retail Pharmacy Partnership Program eventually receiving vaccine. Our CDC Long-term Care Partnership Program completed the vaccinations in April. There were 137,730 shots were administered to the staff and residents at long-term care facilities throughout Arizona. Over 80,000 of those doses went to residents, and almost 57,000 of those doses went to the staff. So this was a large project and was one of those projects that was able to protect some of our most vulnerable populations here in Arizona. So a couple of announcements with our COVID-19 vaccine distribution. This week, we announced that we will be accepting walk-ins at all 7 state-run sites. Anybody who is in the area of one of those sites and decides that they want to get vaccinated can just walk in, and they will be guaranteed a vaccination. There are same-day appointments available, and you can go onto our website at azdhs.gov/findvaccine to find a same-day appointment. The advantage of applying for or arranging an appointment is that your information is already entered, so the visit when you walk in will be much quicker because they will not have to register you on site. So that will speed up the time that you are at the state pod. But we want to make sure that we are removing all barriers. And so you can walk in during operating hours to get vaccinated. Again, we continue to release appointments on Fridays at 11, and we've now got 7 indoor vaccination facilities. Dexcom is our only drive-through location. That's the one that opened on April 5th. It's currently open from 7 to 9 and can offer up to 3,000 to 4,000 appointments per day. Desert Financial Arena opened on Monday, April 12th. This was where we transferred the Phoenix Municipal Stadium in. Individuals can walk in anytime between 7 a.m. and 5 p.m. There's approximately 3,000 to 4,000 appointments offered there per day. And that's really close to some of the public transportation right near ASU. And so anybody who's in that area can just walk in and get a vaccine. The Glendale pod at Gila River Arena, this is where State Farm Stadium transitioned to last Friday. They are open from 7 a.m. to 7 p.m. and there are up to 10,000 appointments per day that people can either schedule appointments for or just walk in. It's anticipated that the Glendale pod will hit 1 million shots in May. A couple of notes about the Gila River Arena, because the Coyotes are so gracious to allow us to borrow their home. There are blackout dates where there will not be walk-in days. So what we would recommend is checking the schedule before just walking in to make sure that the arena is open on that day. Our WestWorld Vaccination site is one of our new sites. It's in the Northeast Valley, and it's currently open 7 days a week from 7 a.m. to 5 p.m., and they can do 3,000 to 4,000 appointments per day. We would encourage you, it's a very nice facility. We would encourage, if you're up in that area and have not gotten vaccinated, they can do it very quickly at WestWorld. And then we've got 3 sites outside of Maricopa County. We've had our longest standing one is in partnership with the University of Arizona in Tucson. They will plan to transition fully indoors and not offer the drive-through opportunity starting on May 3rd. They are open daily from 10 a.m. to 10 p.m. and they offer more than 4,000 appointments a day. They do also have a walk-up location that has run concurrently with their drive-up, but starting on May 3rd, it will be walk-in or I guess indoor walk-in appointments only. No drive-through option will be available. The Yuma Civic Center is a state-supported site that is operating at the Yuma Civic Center, and it is open daily from 7 a.m. to 8 p.m. It can offer approximately 8,000 appointments per week. We want to encourage and congratulate Yuma for initiating their 30,000 doses in 30 days campaign, really encouraging the citizens of Yuma and the surrounding cities to get vaccinated. And so we've been working with them as they continue to encourage those residents to get vaccinated. And then finally, our Northern Arizona University vaccination site. So this is an indoor walk-up site that's open from 8 a.m. to 6 p.m. and can also offer approximately 8,000 appointments per week. And that serves our Northern Arizona communities. At any of those sites, you can book appointments at podvaccine.azdhs.gov, or you can call our call center at 844-542-8201. A lot of times you will find same-day appointments at all of our sites. We've got 7 sites around the state. You can also bring your family all at the same time. And so all state vaccination sites offer the Pfizer vaccine, so it's eligible for ages 16 and older. We do require that a 16 or 17-year-old be accompanied by a legal guardian, and we need a consent form signed by that guardian. So there's lots of benefits of getting vaccinated, and we would encourage everyone to get vaccinated. But we are seeing more appointment. So if you do not want to drive to one of our state-operated pods, there are lots of other strategies in order to get vaccinated. So if you're at your local CVS or Walgreens or grocery store that has a pharmacy, you can make an appointment, and you do that directly through that pharmacy's website that you cannot do through podvaccine.azdhs.gov. However, if you are looking for a pharmacy close to you to get vaccinated, you can find those pharmacy locations at azdhs.gov/findvaccine. You can choose a specific pharmacy by their location, and it will take you, there's a link on our website that will take you to that pharmacy's registration website. And so we would encourage you, if you do not want to go to a state-operated pod, you can always go to your local pharmacy to get vaccinated. And now we are looking at expanding vaccine availability throughout the state. When you look at our, sorry, this slide didn't get updated, you guys, I apologize. So this is the state pod vaccinations. However, what we wanted to show was the statewide vaccinations. What we're seeing is we had seen about 4 or 5 weeks ago, we had hit our peak of vaccinations per day. We are starting to see a decline, and a decline in the demand. And you can see that here as well with our state pods. And so what we're asking our media partners is, we need your help to encourage and drive demand for vaccine. We know that the vaccines are safe, effective, and free, and are extremely effective in preventing hospitalizations and deaths. I just showed you the pod vaccine data, but the state vaccination sites have administered over 1.4 million doses around the state. That's approximately 30% of all vaccinations given in Arizona. So the state pods, they have been a very successful driver for getting Arizonans vaccinated. That is just one part of the state's overall vaccine strategy. Our main goal since the beginning has been to get vaccines out and available, but eventually moving to where Arizonans can normally receive their health care. And so what you'll see is you'll start to see it show up in more places as we continue to move forward in our vaccination efforts. So like I said, federal retail pharmacies can vaccinate people age 16 and over if they have the Pfizer vaccine. There's over 975 pharmacy locations in Arizona currently receiving a federal allocation of vaccine. And as that continues to expand, and as more and more pharmacies, will have over 1,000 retail pharmacies that we will be able to provide access to vaccine around the state. One of the announcements we announced today is that providers can directly order vaccines starting next week. So on May 3rd, AZDHS will enable eligible providers to order the Moderna vaccine directly from ASUS without needing an allocation from a local health department. We are anticipating that more than 100,000 Moderna doses will be available for direct ordering during the first week. And so we're very excited about that. This will be open for eligible onboarded pandemic vaccine providers. And so if a provider wants to become a vaccinator, they can go to our website. They do need to complete the AZDHS onboarding tool. That is a federal requirement in order to be a pandemic vaccine provider. There are certain requirements that they will have to meet. Our immunizations program office will help walk them through that. Once they are approved, they'll have access to ordering Moderna vaccine in our ASIS, which is the Arizona State Immunization Information System. That's our immunization registry, but it also does all of our ordering and inventory. And so you can find more information available at our websites on how to become an onboarded provider. For community-based vaccination events, that is something that we continue to work with our local county health departments as well as community providers. You will see more community-based events and faith-based organization offering events so that we can continue to increase vaccine access. So for example, Pima County is partnering with FEMA to offer mobile vaccination units. Those will start Monday and will provide high-risk populations with access to vaccine. And another example, multiple counties are partnering with the University of Arizona's mobile clinics to reach out to migrant farm workers and other underserved areas. This week, we held a telephonic town hall with the areas of around Yuma, so the Yuma, San Luis, and Somerton areas. We hold those town halls both in English and in Spanish. Last week we held one for Districts 7 and 8, and I apologize that didn't get updated on the presentation. And we will continue to expand that direct outreach. In addition to the teletown halls that we conduct, we are also doing yard signs, geofenced social media messaging, and direct messaging to those communities to encourage them to get vaccinated. We talked a little while ago about the opportunity that we were partnering with Ability 360, Passport Health, the Arizona Commission for the Deaf and Hard of Hearing, Special Olympics, and the ARC of Arizona to offer a vaccine event for our disability community. The weekend of April 10th and 11th, over 1,600 Pfizer shots were administered. This weekend, we will be offering the second dose for those individuals. And so to find out more information, you can go to Ability 360's website. But that's just one example of how we're reaching out to other communities. So other announcements. What we have been identifying is that fewer routine childhood immunizations have been given during the pandemic, and vaccines are a very, very important component for keeping our communities safe. And so CDC is calling May through June a back-to-school sprint. 738 of the nearly 1,200 onboarded pandemic providers currently indicate that they have the ability to serve pediatric patients. We want to make sure that not only are they getting their COVID vaccine when it becomes available to them, but that they are fully vaccinated and up to date on their immunizations. You can find additional vaccine locations. There are the state vaccination sites are available to vaccinate those that are 16 and above, but as we get it into more and more providers' offices, there will be more opportunities for our parents to get their kids immunized. This week, CDC released updated guidance for fully vaccinated individuals, and that includes now that fully vaccinated individuals can do certain outdoor activities without wearing a mask, and that includes things like walking, running, biking, or hiking outdoors with members of their household, attending small outdoor gatherings with fully vaccinated family and friends, or a mixture of fully vaccinated and unvaccinated individuals, and dining at outdoor restaurants with individuals from multiple households. They still recommend that you wear a mask if you are going to be at an outdoor event, such as a sporting event where there's going to, or a concert where there's going to be large numbers of people that you don't know. But this was encouraging because this is just one more step to returning back to normalcy. We would still encourage those that are unvaccinated to get vaccinated. The more people we can get vaccinated, the safer our communities will be. And there still are instances that even if you are fully vaccinated, that we recommend wearing your mask, especially when you are indoors with people that you do not live with. But that was very exciting. We have a blog that you can read about these updated CDC recommendations at AZDHS.gov. The other exciting news was we knew that the clinical trial data showed a really successful effectiveness against hospitalization and death. However, sometimes that clinical data does not translate over to the real world. So we were very excited to see that real world data shows that the vaccination is highly effective in preventing hospitalizations. And so the CDC released a MMWR article this week that says that the effectiveness of the vaccines in preventing hospitalizations in individuals 65 and older for COVID-19 associated hospitalizations is 94% for fully vaccinated individuals and 64 to 65% for partially vaccinated individuals. And this real world data was consistent with what they saw in the clinical trials. They only did these clinical trials with patients who had received Moderna or Pfizer because these started being conducted prior to the release of the Johnson & Johnson vaccine. But it is very, very encouraging news. As of today, over 80% of Arizonans 65 years and older and nearly 60% of those 55 and older have been vaccinated with at least one dose in Arizonans. So this is really, really good news. We've still got more work to do to get all of them vaccinated, but highly encouraged that hopefully we are preventing a large number of hospitalizations and deaths in those that are at more risk for those bad outcomes. And thank you for joining us. With that, I will turn it over to Steve for questions.
The first question is from Howard Fisher.
Hi, Howie.
Good afternoon. That's why I get in line, so I come up here. Let me ask a quick technical question first. You mentioned in terms of the doctors getting the Moderna. Is that from CDC or is that from ASUS?
So they will order through ASUS. This is the similar program that our Vaccines for Children providers do. So this is how the federal government allows you to order through their program. So what they will do is they will just go into ASUS, be able to order up to 200 doses of Moderna. If they've got a special event, they can just let us know and we can increase that amount. But they will be ordering it from ASUS.
Okay. What took so long? I mean, I know the governor issued an executive order in December basically saying we don't want doctors to have, in fact, it's allowed you to seize other doses that may have gone to somewhere else. We've seen the charts that show a steady decline in the number of vaccines being put in arms at state-run sites. What took so long for you to finally ease up and say, well, maybe there's an alternate method?
So CDC just recently allowed states to make the decision on whether they wanted to do that or not. And so we've been working with our county health departments who also agreed that we should go ahead and open up ordering. So it was a combination of steps, but we're excited that providers are going to be able to do that now.
Okay. Also looking at charts, journalistic numbers are always a bad combination. We seem to have hit a plateau. We're at the same levels of infection that we were last September. And that's before there was a vaccine. What's going on here? We seem to be hitting the same number of cases per day that we were before there was a vaccine, before we had shots in arms. Is this a result maybe of us relaxing some of the mitigation requirements or what?
So I don't know that we'll ever get to zero with our cases. The plateau is good, especially as we have been relaxing the mitigation strategies. And so, we continue to monitor. I don't know if we'll see another increase in cases. What we would anticipate is that it wouldn't be paired with such high hospitalization rates and deaths that the vaccines would prevent those types of things. But we are encouraged by the plateau that we've gotten down and have been able to remain down and remain this low moving forward.
Okay, which leads to the final question, which is, you and the governor relaxed the school requirements, say, sort of dumping in the hands of a bunch of local school boards. And the governor said, well, this is in line with CDC guidelines. Well, of course, we all rushed to the CDC website and found out the CDC was, in fact, still recommending it for schools. So who's zooming who here? You know, are we getting BS on this?
No, so I think that there's a difference. So while the mandate requirement changed, the recommendation never did. So we are allowing the schools, our recommendation is that schools should be using masks as part of that layered mitigation strategies in the CDC guidelines. CDC does not mandate, CDC recommends, and now the state recommends that. And so that's what we say. When we're in alignment with the CDC, we don't have a mandate, but that recommendation still remains.
But it was always a CDC guideline. Nothing changed at the CDC, yet the state changed and created this horrible situation for school boards. Why did you do that with only a few weeks left in school?
Well, schools have had the opportunity to make the decisions about whether, you know, we didn't mandate whether they were in virtual, in person, or hybrid. I mean, that was always a recommendation. Then we adopted the new data elements that they did, and then we were getting a lot of feedback about mandating, not mandating, allowing schools to decide from parents and from the community. So then we did say we are just adopting the CDC recommendations. The school boards can decide for themselves on whether or not they want to have masks.
And you would get the Johnson & Johnson vaccine even though you're in that women's age group? I know you're fully vaccinated. Or did you?
Yes, actually, I would get the Johnson & Johnson if that was the vaccine administered or offered to me and I was unvaccinated. You know, I'm not one that wins the lottery. It's a really, really small risk. And I would recommend getting the Johnson & Johnson.
Fair enough. Thank you.
You're welcome.
Cameron Paula.
Hi, Cameron.
Hi there. Continuing on Howie's question, you know, I mean, do you feel for these boards, these school boards that have felt parental pressure to make a decision based on that pressure and not health CDC recommendations?
You know, I think that the school boards have to make a lot of decisions based on kids and based on their communities. There are non-health related decisions that they make all the time. And we were, you know, trying to be consistent with CDC's recommendations. And so a lot of these decisions are hard. I've had to make a lot of these decisions myself as well. And so I would encourage them to use the CDC as their backstop or use the AZDHS recommendations as their backstop. But there wasn't really an enforcement mechanism even when we did have the mandate. So it's really up to the schools to decide whether they want that mask mandate, which is or that mask requirement, which is our recommendations they do. But then they have to determine their level of enforcement and ability to be able to enforce it in their schools, which was something we were not able to do.
Yeah, it's tough when you have people kind of banging on your doors when you're trying to discuss those things and, you know, have the critical thinking to do the right thing for the community in those tough situations. So obviously it doesn't seem like it was easy for these folks. Two, you know, obviously we're seeing a major drop off in vaccine. Can you talk a little bit about this? It does seem concerning, especially that there are quite a few people who are unvaccinated still.
Yes, so, you know, we continue to monitor the number of vaccines that are given each day. We are seeing that now the supply is meeting the demand. There are plenty of appointments at state-operated pods. There are plenty of appointments that we hear of in our retail pharmacy partners. And so now we knew that, you know, those that were very, very motivated to get the vaccine were going to do whatever was needed, even if that was driving to Glendale at 3 a.m. in the morning to get that vaccine. We knew that that was kind of our low-hanging fruit in Arizona. As we've, you know, kind of gone through that population, now we know we've got individuals who still probably are willing to get the vaccine, but may be busy, and now we have to make it more convenient, more in, you know, the areas where they live, work, and play, at their grocery stores, at their pharmacies. So you'll see that start to open up when they go to see their physicians. That will open up starting next week, and then more and more of those community pop-ups by trusted healthcare providers. And so we'll be working on that as well as additional messaging. But we would like to continue to see the number of Arizonans getting vaccinated continue to increase. And so, because we do want to hit that herd immunity.
One more question. Talk about the mobile clinics. So that's going to be an important part to reach communities. Can you talk a little bit about how those work, where they'll be, and who they'll be targeting?
Yeah, so we are working with the county health departments, and they actually might be better than me explaining where and when they are. We do know that FEMA is working with Pima County to initiate 2 mobile clinics. It will go to 10 locations around Pima County, and that will be starting on Monday. We also know we've been working with Maricopa County and Cochise County and Yuma. They've been working with the University of Arizona, has a mobile clinic that has gone out. They've actually had this really cool mobile clinic for a number of years now. And they would go do health screenings and health checks to migrant farm workers and out in rural areas. Now they're offering vaccine through those mobile areas. So some of the county health departments are taking them up on their ability to do mobile vaccinations. I know that the NAU pod has also started utilizing some of the vaccine to provide mobile clinics to rural areas or into other areas that may not be able to access the state-operated pod and provide vaccine in there. I don't have specific locations, but those county health departments definitely do.
Thank you.
You're welcome.
Next is Bud Foster.
Hi, Bud.
Hello there, Dr. Christ. Thank you very much for doing this. We really do appreciate it. Nice to talk to you again. We keep hearing that this is not over yet, and I think most everybody agrees with that. When you see what's going on in India and all of the pictures that we see on television now, with the record number of deaths in South America, what do you think? What's your concern?
You know, I think there's always a concern, especially when you're dealing with an infectious disease like COVID-19. I mean, we're watching for the variants. We're monitoring on a daily basis our case numbers, our hospitalization rates. I think, you know, what I'm reading about going on in those areas is horrific. And we certainly don't want to see that here in the United States. And I think in the United States, we're very fortunate. We have the tools that we need. You know, we know that wearing a mask, staying physically distant, staying home when you're sick will help prevent the transmission. And we have a highly effective vaccine that reduces the occurrence of hospitalization and death. We now have ample appointments. There's adequate capacity to go get vaccinated. And that will prevent what is going on in India and those other areas. And so that's why we are strongly encouraging everyone to get vaccinated.
Might also induce some people to get vaccinated as well. And just one final thing here. Where are we right now? Where do we stand? Because I know you said the cases are ticking up a little bit. It's been 5 weeks since everybody has now been eligible to get a shot, but yet we've at that plateau and things are not decreasing. Where are we and where do we stand in this pandemic in the state of Arizona right now?
Oh, goodness. That is a really great question. Where I would hope we would stand is that potentially, you know, we continue to get people more and more vaccinated. I think we may see another increase in cases, but hopefully won't see the hospitalizations and deaths. What I would hope, and again, I keep asking FEMA for my crystal ball. I haven't gotten one yet, but is, you know, we might see a steady increase in cases, but as we get more and more people vaccinated, come the end of the summer or beginning of fall, we hopefully will reach some herd immunity. And then this would become like just another infectious disease that is with us, like the common colds or, you know, the influenza that returns every season. However, you know, I watch, just like you guys do, what goes on in other parts of the world, in other states. And, you know, also know that we could have another increase like Michigan or like India. And that's why we're trying to do everything we can to get access to the vaccines, which is really going to be our best tool for preventing things like that. So hopefully we're on a plateau that, you know, may increase and may have more cases, but people aren't necessarily being hospitalized and dying from it. but we still could be facing another surge, and that's what we're watching for every day.
Thank you very much.
Thanks, Bud.
Christina Durant.
Hi, Christina.
Hi, Dr. Chris. Thank you so much for taking the time. So actually, following Bud's question a little bit, reaching herd immunity, how feasible is that without vaccinating children?
Right. So that's a really great question, because we do know that we have got a lot of children, and especially with things like influenza and those, they tend to spread disease. But what we're hoping is that by mid-May, Pfizer will have approved vaccination in 12-year-olds and above by the FDA, that their EUA will include that. And so with that, what we would hope is that we would see another significant increase in people getting vaccinated for a couple of weeks. We anticipate that there's about 320 to 400,000 more Arizonans that would make eligible for vaccination. Without having it all the way down to the population, that makes it a little bit harder, because we want to have about 70 to 80% of those of the community vaccinated. So we continue to watch to see what our drug manufacturing partners are doing and what they're submitting for approval. But that does make it a little bit more difficult, because when you're talking of about 7.3 million, 5.5 million of those are 18 and above approximately. And so you've still got a large portion of the population that's under 18 and could continue to spread.
And then can you talk a little bit about how maybe the doctor's offices and clinics could address vaccine hesitancy? Do you think people would be more willing to get vaccinated if they came from their doctor?
So based on our community listening sessions, people indicated that a recommendation from their healthcare provider, that would be one of the things that would drive them to get vaccinated. So they trusted their healthcare provider, and then those that they personally knew who had already gotten the vaccine. And so we do believe that if somebody's there on their annual checkup and it is recommended by their healthcare provider, and somebody can answer, that healthcare provider can answer questions that individual may have about, how safe is the vaccine? What would the side effects be? What are the risks associated with it? And a lot of people have very specific medical conditions that they want to know how the vaccine is going to impact that, or how COVID's going to impact that. And so, kind of going back to Howie's question, I absolutely would get the Johnson & Johnson vaccine, and I would advise a patient of mine, you're at higher risk for getting blood clots if you get COVID-19 than you are from getting a blood clot from this vaccine. And so, hearing those types of facts from your healthcare provider who is actively encouraging you to get vaccinated, and by the way, they have the vaccine, we just go in the next room and get it, could be a major driver for getting some of those that just want more information about the vaccine in order to get it. I think it would be a big help.
And then talking about the J&J, so I was actually at one of the mobile clinics, and I believe they had like 200 J&J allocated for that day, and only 7 people actually volunteered to get it. So is there a concern of vaccine wastage as all these J&J go out now, but people aren't taking them?
So there's always a concern about vaccine wastage. I think it was a significant concern when we had such high demand and, very, very little vaccine. However, once you draw it up, the Pfizer really is the one that has that really strict, like once you redilute it, or once you dilute it, you have like 6 hours to use it. The other ones have longer time frames and are a little bit more user-friendly, which is why they're better suited for mobile options. And so the providers, that's part of the onboarding processes. They learn how to, they have to learn how to manage the vaccine and how to store it and utilize it and use it properly and report wastage. So hopefully they're taking those steps to prevent the wastage.
Thanks so much.
You're welcome.
Alex in Tucson.
Hi.
Hi, thank you for taking the question. So on the dashboard for, I think, the entirety of the vaccine administration the life of the vaccine administration page, there's been the clause that says, due to the phased approach of vaccine distribution, demographics presented here are not yet expected to align with general population demographics. So now that those 16 years and older are eligible, what's holding the state back from seeing those demographics align? And when do you expect the race and ethnicity demographics of overall vaccine distribution to align with the general population's race and ethnicity demographics?
So that's a really good point. That probably should come down off of our website. I'll talk to the team. But now that we are vaccinating the general population and we've had multiple weeks where that everybody has been eligible, that disclaimer probably should come off of our website.
Okay. And then when do you expect to see those demographics align with the general population race and ethnicity demographics?
Yeah, so, those are some of the things that we're working on now. I don't know that I have an anticipated timeline, if ever, that it will exactly match the demographics of the state. There are some caveats to the data. One would be not all IHS and federal facilities are reporting to us. So I don't know that our Native American demographics will ever fully match the Native American demographics for the state. And we know that we've got vaccine hesitant populations. And so while we're working with the leaders of those communities to really increase messaging and to increase, the communication and the encouraging of getting the vaccine, I don't know that they ever will meet the state demographics for those. But we continue to work to increase, especially among our hardly reached and underserved areas, to get them vaccine and to increase access in those areas.
And what sort of strategies is the state promoting or using to move closer to that alignment?
Yeah. So some of the things that we're doing is we're working on highly targeted communication campaigns in areas that we know have low vaccination rates but have been hit hard by disease. So we've recently initiated a campaign in Yuma where there will be very similar to the 85009 zip code, where we are doing telephonic town halls in both English and Spanish. We are doing door-to-door canvassing, yard signs, geofenced social media in both English and Spanish, and driving them to English and Spanish versions of our website. And so what we hope to see similar results in our Yuma area that we saw in our 85009, but we've also expanded that same program to Phoenix City Council Districts 7 and 8, as well as we will be working in southern Arizona and in the Mesa area to do these same types of strategies. And then we're also working with some of the trusted leaders, so to offer in-community pop-up events. And so we've been working with like Arizona and Equality Health. They've been offering in the community vaccination events for the last few weekends, working with our county health department partners to offer additional community events as well as those mobile strategies. And then, our county health departments are really the boots on the ground and the experts in their communities, and they've been the ones who have been working directly with their communities to encourage and to increase access in those areas as well.
Thank you.
You're welcome.
We're going to try to get to as many questions as we can by 2 o'clock, but we do have a hard stop, just to let you know. Hold on. Josh Sanders. Let's see.
Hi, Josh.
Hey, Dr. Chris. Happy Friday.
Happy Friday.
You mentioned that you would expect that Arizona could possibly see another surge, but hospitalizations would not increase. But we have seen in the last 2 weeks an increase in both hospitalizations for COVID inpatients by 20%, ICU beds by 23%. Why is that?
So I'm sorry, I guess I should clarify. So thank you, Josh. We would not expect to see the same surges that we did in the past. As we're looking, we have seen slight increases in hospitalization in our ICU and in our med-surg beds. We know that everyone's not vaccinated, and we do know that there are COVID-19 is circulating in our communities actively. We're monitoring that. What we're also seeing is that we've got that younger population that is not as vaccinated as our older population, and really our older population is the more vulnerable. So that's what we targeted first in getting the vaccines to them, to prevent those really, really high rates of bad outcomes and death. But now we're starting to see, that younger populations are being hospitalized, and we continue to monitor. I don't anticipate that we would see those like long-term care patients and the elderly who have been vaccinated needing as much hospitalization. But again, no vaccine is 100%. And that's why we try to get so many people in the community vaccinated, because it allows for, less chances for the disease to reach somebody who is unvaccinated. But we will continue to see cases and hospitalizations, just hopefully not to the same magnitude that we have before.
Outside of the vaccine, though, could this be a consequence of lifting those safety mitigations, variants of the virus, anti-maskers, increased capacities in bars and restaurants?
So, as the community comes back together, we will see transmission. That's part of how this virus transmits. What I would recommend is everybody knows what to do to prevent COVID-19, and everybody has access to the tools to prevent it. So when I go out, I still wear a mask. I don't go out as much as I probably used to. I do try to stay away from people more, that I don't live with, but as an introvert, that kind of makes me a little bit happy. And I also have been vaccinated. So I do know that hopefully if I get COVID-19, it's going to prevent me from being hospitalized or potentially even dying. But we would encourage every Arizonan to continue acting like that until everybody, until we reach herd immunity, which is still going to take us a little bit. But we do need Arizonans to help, get up there to herd immunity. Those that haven't been vaccinated, we highly encourage them to get vaccinated.
I'm with you as an introvert, but does the state bear any responsibility for lifting those mitigations? Does the state bear any responsibility?
I think it was difficult without the enforcement. We got to the point where we were able to vaccinate. Some businesses still do require it. But even with the mandates and the requirements, individuals were not wearing masks, and it was not being enforced except at the types of facilities, those very select facilities that we were, requiring to have those mitigations. And so I think that it's, people have the tools we know how to prevent COVID-19, and people just need to take the steps to do that if they feel that they're at high risk for COVID-19.
Last question. You've seen the success from our Native brothers and sisters in the Navajo Nation. They are over 50% of adults fully vaccinated. Are there lessons that we can learn from them? And when, you kind of answer this, but when do you expect, or you don't have a crystal ball, when do you expect
Not yet.
to reach the herd immunity?
Yeah, so, we're hoping that we'll be able to reach herd immunity by the end of summer, beginning of fall, and return back to some kind of normalcy. Our Native partners, and this just isn't in COVID-19, but our Native partners do a very, very good job of having high vaccination rates. IHS does a really nice job with vaccinating. And so because our federal partners knew that they were at such high risk, IHS got their own allocation of vaccine. And then we were including those counts as well in county health departments that had substantial tribal presence in their counties, because we also know that tribal members can receive care off the tribe or at non-IHS or 638 facilities. And so, really opening up that opportunity. But they were highly vulnerable to bad outcomes with COVID-19. And so again, that was one of the reasons that they were prioritized. But I'm really, really glad that they've got such high vaccination rates, because that's very important.
Thank you.
Yeah.
Deborah Dale.
Hi. Can't hear.
Got on mute.
You might be on mute. We're going to try again.
All right, I'm going to move on to.
Okay.
There we are.
Hello.
Hi.
Here I am. I am so sorry. Hello,
It's okay.
Dr. Chris. I am just curious. First of all, most of my questions have been answered. Thank you, fellow reporters. But do you think we will make herd immunity? We're at 40% vaccinated, and demand has dropped off drastically for the vaccines. And there are a lot of vaccine hesitant people in our state. Do you truly think we can reach herd immunity, or are we just going to be faltering and then the variants are going to come in and all bets are off?
I'm hopeful that we can reach herd immunity. You know, I think we've always been, I think that's always been a worry that we wouldn't reach herd immunity. And that's why we are taking such an active role in getting PSAs out there and education and working, you know, with our local health departments and community providers, because we understand the importance of vaccination, especially in this context and especially with things like variants that could come up. Luckily, the vaccines appear to be working against the variants that we see circulating in Arizona, but we know that that's what viruses do. They mutate. And so we want to make sure that Arizonans are protected, but it's always been a worry, even before the vaccines were here, on if we could reach herd immunity. But we're, you know, when you look at our eligible Arizonans, you know, that I think that 40% is out of the full population of Arizonans, and so we are a little bit higher when you look at those that are eligible. And when we do get approval to do the 12 to 15, that's going to open up another group that has demand that has not been eligible for the vaccine just yet. So we will continue to encourage and work and try to get around some of the reasons why people are hesitant about receiving the vaccine. And hopefully, as those individuals see trusted friends and loved ones getting the vaccine and still being safe, hopefully that will encourage them to do it too.
Out of curiosity, you opened up new appointments today. As of Monday, you still had 60,000 or so available at state sites. Did those ever run out, or did we still have an excess when we opened up the new ones this morning?
So we still have open appointments from last Friday. We still have appointments remaining for this Saturday and Sunday, and then what we opened up today will be for Monday through next Sunday. So yeah, we still had unfilled appointments available.
Quick follow-up. If you continue having so many unfilled appointments, would you consider moving more of the vaccine to providers directly instead of the big sites?
So we continue to monitor for the need for the mass vaccination sites. It's been a really successful strategy for quickly vaccinating individuals, but it's not our long-term strategy. So yes, we would be looking at when are they no longer effective. You know, right now we're still giving lots and lots of first and second doses in Arizona, but we'll continue to monitor. I think we're releasing over 100,000 doses this week that will become available to providers, and we'll keep adding to that. And hopefully also, I think one important message and an ask from the department, you know, to encourage providers that aren't onboarded to get onboarded so that they can offer vaccine directly in their offices.
Is there an easy link for providers who may be listening?
We can send that to you. I don't know if there's a shortened URL on that. Is there, Steve?
Is.
There is. Hold on. He's gonna get it for me. We do, and it is on our website, and there is a step-by-step process. A lot of pediatricians, because they're already in the Vaccines for Children program, which is the same type of federal program, would meet the requirements if they're not onboarded. They just have to show that they know like about the COVID-19 vaccine and that. But we need adult providers to get onboarded. Do you have it, Steve?
azhealth.gov/vaccine provider.
So it's azhealth.gov/vaccine provider.
It's in the release if you need the link.
That's easy. Thank you.
You're welcome.
Okay, we're right at 2 o'clock. I'm sorry to those we couldn't get to. We did our best, and everyone have a great weekend. Thank you, Dr. Christ.
Have a good weekend.
Thank you.